Good evening, and welcome to the virtual forum on the state of COVID-19 in the New River Valley, presented by the New River Valley Public Health Task Force. We appreciate you welcoming us into your homes or wherever you may be viewing this event. It has been approximately 1 year since the onset of the pandemic, which has dramatically reshaped our daily lives. Tonight will be an opportunity to share a status update on many issues related to the pandemic, to include the prevalence of the virus in the region, testing and vaccine efforts to date, support systems for businesses, and insight on mental health impacts of the pandemic. You will learn as we move through our program, the New River Valley is blessed with leaders who care deeply about our communities, and they truly work well together. As a result, our citizens should feel confident as we collectively navigate COVID-19 in the New River Valley. Tonight, we're joined by Weston Broach and Matt Burton, providing sign language interpretation services. Thank you, Weston and Matt, with your assistance for our forum this evening. My name is Kevin Bird, and I'm Executive Director of the New River Valley Regional Commission. I had the pleasure of serving as moderator for the 6-episode virtual town hall series this past spring, and again for the forum this evening. The New River Valley Public Health Task Force I referenced earlier has been hard at work for over a year, aligning resources and deploying strategies to support the public health needs of the region. The task force continues to meet 3 days per week since last March. Each step of the way, they are focused on identifying needs and finding solutions that make an impact on communities across the region. The task force is comprised of local law enforcement, fire and rescue organizations, hospital and public health officials, local government managers, state agencies, local public information officers, education officials, and others, all working to address COVID-19. Since last March, the task force has a long list of resources made available to the community that includes expanded testing in partnership with Virginia Tech, consistent public health messaging in an ever-changing environment, a website updated daily with regionally specific information, which is www.nrvroadtowellness.com. The region launched the first vaccine call center in the state, which resulted in calls coming in from Virginia Beach to Lee County and everywhere in between. The task force organized and operates regional vaccine sites that can administer over 1,200 doses daily. There are a whole host of other accomplishments, along with countless volunteers and partner organizations involved in making all these steps possible. As director of the Regional Commission, it has been nothing short of remarkable, seeing the level of collaboration taking place in the region over the past year. We're thankful this region had relationships in place before the pandemic, because it truly allowed partner organizations to trust each other to execute. The New River Valley is somewhat an anomaly as you look across the state. We've continued to work together and maximize limited resources to have the greatest impact. As a result, we have some of the highest vaccination rates in the state, which is helping people return to our daily lives safely. To date, over 65,000 vaccines have been administered in the New River Valley, with more than 23,000 residents fully vaccinated. However, a lot of work remains, and the task force is committed to seeing it through. The questions the panel will be addressing tonight were submitted by residents across the region prior to tonight's forum. As I introduce each of the panelists, they're going to provide a brief introductory statement. So I'll go ahead and welcome our panelists this evening. You can go ahead and turn on your cameras and make your microphones live. First up, we have Dr. Noelle Bissell. She is Director of the New River Health District.
Good evening. Thank you so much, Kevin, for moderating this evening again. Noelle Bissell, Director of the New River Health District. I've been overseeing the public health response as part of the task force during this pandemic. That included first getting our testing up and going. It included Jason and his team with the case investigations and the contact tracing. My environmental health team has been doing the environmental health and the complaints of the executive orders and helping with the enforcement and interpretation of the executive orders. vaccination efforts.
Well, thank you, Dr. Bissell. Next, we have Jason Deese. He's the district epidemiologist for the New River Health District.
Hi, everyone, and thanks for the introduction. Basically, as a district epidemiologist, I've lived and breathed COVID, hopefully not literally, since January of last year when the news first broke. I lead a team of epidemiologists and case investigators and contact tracers who assist with our caseload when we get positive lab results and reports of positive patients. We go forth and investigate and do our best to get people isolated and quarantined. So that's the primary response. But beyond that, I spend a great deal of time advising people, whether they be the schools or nursing homes or childcare centers or various and sundry other businesses and entities. So that's my job in a nutshell.
Great. Thank you, Jason. Next, we have Ashley Briggs. She is the Public Health Director for the New River Valley Business Continuity Team, which is a program of the Regional Commission in partnership with the Health District.
Thanks, Kevin. As Kevin said, I'm Ashley Briggs, the Public Health Director for the New River Valley's Business Continuity Team. Our team's fairly new. We were stood up in August by the local localities in partnership with them. They put forward some funds along with some grants that we were able to receive to help businesses really navigate the COVID-19 environment and the landscape as we've gone from complete lockdown now through to vaccination efforts. And we've been able to hold their hands and really help them as guidance has changed and regulations have changed, and really be that conduit between the businesses and the health department, because Jason is only one person. And so he's not always able to answer every call. So we've really been partnering to make sure that businesses get every answer that they need so people can be quarantined and isolated appropriate and businesses can remain as open as safely as possible.
Terrific. Thank you, Ashley. Next, we have James Pritchett. He's Executive Director of New River Valley Community Services.
Good evening, Kevin, and thank you for hosting tonight. As you said, I am the Executive Director of New River Valley Community Services. We're the public behavioral health care provider for the New River Valley. We provide services to individuals and families with mental health, substance use, and developmental disorders. We serve citizens in Montgomery County, Pulaski, Floyd, and Giles County, as well as the city of Radford. We've been a happy partner in the task force. And we've been right there on the front lines trying to figure out how to meet the mental health or behavioral health care needs of the citizens in the area, because we all know that it's taken a toll on the individuals out there because it's really disrupted our daily routines.
Oh, no doubt. Well, thank you, James, and thanks to each of our panelists for joining us this evening and providing insight on the response to COVID-19 in the region. Our first series of questions pertains to the prevalence of COVID-19 in the community. Dr. Bissell and Jason, can you both discuss the trends you've observed in the region over the past year, taking us up to the most recent data?
Yeah, I'd be glad to start it off. I don't know that I'm going to rehash every step of the last year because we all lived it, and I think it was burned very much into our brain what we went through last spring with the lockdowns, and through the summer there was, we had a couple peaks and valleys during the summer, and then we had the universities come on where we saw spikes, especially among the student population, and there were separate trends within our local communities. We had some nursing home outbreaks that occurred back in the fall, later in the fall. Those thankfully are done. And we did have a holiday surge between Thanksgiving and just shortly after Christmas. And now I'm happy to report that we are on the downslope of that winter surge. So I do have some slides that I would love to share with you. The bad news here is that COVID is still in the area, but there is plenty of good news. And tonight I want to be, I want to put a positive spin on this as much as possible. So, as soon as these slides are up, I think the pictures tell the story of what's really going on, and I'm really happy to be here tonight to explain some things. I know that there have been lots of questions through various leaders in the community, as well as just common curious folks and people who are following everything on the state website. And so here we go. The first slide that I'm going to show you is our overall Epicurve from November 1 until this week. Okay, and an Epicurve, the presentation here is a little bit different than what you will see on the VDH website. The main difference is that epidemiologists typically use Epicurves to show how a disease of interest is moving through a population. And the best way to do that is with symptom onset date or lab collection date if there's a lack of symptoms. Okay, and we know that there are asymptomatic cases of COVID. And so for COVID specifically, it's onset date or lab collection date. As you can see in this one, we're relatively stable level for the past few weeks overall for the district. You see on the right side of the chart that typically will fill in because we are using onset date and lab collection date. There is a little lag related to the time it takes to get that illness reported and do the investigation. So that last bar there typically does fill in and probably will land somewhere this week between 300 and 400 range. Okay, so that's for the entire district. We're talking about Floyd County, Giles County, Montgomery County, Pulaski County, et cetera. And I'm going to go through county by county really quick per county just to show you that all of our jurisdictions, the case reports are dropping. So you saw Floyd flash up. We are down to single digits per day in Floyd County as far as reports and new onset. Okay, next slide. Giles County, same thing. We're down to single digits per day, and that's stable for a couple of weeks. Next. Pulaski County, same thing. Pulaski had a rough time back in the November, December timeframe, but things have dropped significantly and stabilized at a low level over the past month. Very encouraging to see this. And next. Radford, and Radford is home to one of our universities, as you probably do know. They did have a big spike back in late August, early September. Things stabilized at a very low level after that. You see there was a holiday surge within the community, and now they're down, including the university, down at a low stable level. Single digits per day. There's a theme here. Okay, next slide, please. And this is the one that I really kind of want to dig into. I did this one in an Excel program so that I could stack the numbers. I painstakingly went through and picked out Virginia Tech and Radford students, mostly college students, from members of the community at large. And as you can see on the left, at the very bottom of the chart, you have that kind of aqua colored. Those are the congregate facilities. Those are nursing homes, long-term care, assisted living. And as you can see, that has come down to basically nothing as far as the congregate facilities. So the major silver lining here is that although we still have COVID in the area, the nursing homes are most vulnerable people. We have had one case, I think, since mid-January among a resident, which is incredible. So I'm very, very happy and very stoked to see that. I guess that's the word, right? If you look at the red, those are the members of local community within Montgomery County. Okay, so your non-Virginia Tech population, your non-student population. Okay, and this might actually be an underestimate of the student population. I was conservative if there was a question on where they belonged. Some of them ended up in the community side. Okay, as you can see, although Virginia Tech has had significant numbers of cases through January, February, and the early part of March, our numbers in the local community have continued to drop despite increasing levels with the students. I'll repeat, despite increasing levels with the students. This is a good indicator that there's very limited spillover from the student population over into the local community at this time. Of course, we're being vigilant about it. We're taking the student cases very seriously and tracing them very hard, but it's really looking good on the community side. And this week, single digits for a county of what, 100,000 people, right? You know, if you want to subtract out students, you could subtract 25 or 30 from there. It's still single digits on our most populous county. Okay, so I wanted to share that with you, that there is good news in this, that even Montgomery County, you know, the local community is trending down. Okay, and next slide. I know there's been a lot of consternation about the school-age kids. School-age kids, our case counts have been very stable. In fact, dropping over the last couple of weeks. We had a little spike in mid-February, and that settled down nearly immediately. And we're down again in single digits per week, or single digits per day at least. And honestly, I guess the last couple of weeks, single digits per week. Okay.
Very
And
good.
that's really all I have to present to you as far as the state of current affairs. Things are actually looking really good out there, and I want to get that message out. One other thing before we move on, if you're looking at the VDH website on a daily basis, please stop. Okay, look at it like this. Okay, I've presented this by week because you don't see those daily peaks and valleys. Those peaks and valleys that you see on a state website are a function of many factors that we have knowledge of within the health district that may not be apparent to your common visitor to that webpage. For example, most of our cases coming from Virginia Tech, the lab cycle plays a very large role on, you know, when we get a dumping of, say, 70 or 80 cases from Montgomery County. That's part of the way that they do the labs and report them. Sometimes there's a little lag and they consolidate and they shift it all over at once. Tomorrow, I expect that we're going to have a big spike in cases after a couple of days of low numbers. Okay, so please look at it the way that I've presented it, and these will be made available on our NRV Road to Wellness page. And you can look at it that way, look at it weekly. If you can't control yourself and you have to go to the VDH website daily, look at the yellow trend line. The yellow trend line gives a better indication of how things are, really going, and it's less susceptible to that peak and valley. Okay.
Great. Jason, thanks so much for the deep dive on data. Like you said, people are really looking at all these sites, and appreciate the accuracy there. And again, those slides will be shared on the Road to Wellness website. One of Jason's last slides was about schools and school-age kids. Dr. Bissell, can you talk about how decisions are being made with respect to school operations in the region?
So in the New River Health District, all of our schools have locally elected school boards who make all of the decisions regarding school operations. They have input, obviously, from the superintendents and the administration, and then we do provide some input from the health department as well. But the decisions are actually made by the school boards for each of our localities.
Very good. Let's talk a little bit about the business continuity team and the work that's underway there. Ashley, can you share why was the business continuity team formed and what services do you offer?
Sure. So the business continuity team was really formed out of the New River Valley's Public Health Task Force. Early on, they saw that there was going to be a need to help businesses recover from those lockdowns early on in the pandemic, as well as navigate this new environment that was going to be with us for quite some time. We knew vaccine was on the horizon at some point, but when we were stood up in August, it was really just ensuring that quarantine and isolation was followed, and that we could keep our case counts as low as possible and our businesses as open as possible. So we were formed to really help with that. And the services that we offer, before vaccine came online, that is, the services we're offering early on were assistance with that, paying for services like having your business cleaned. Having a business cleaned can be a really costly thing after a COVID-19 impact. And so we were offering help to cost reimburse for some of those services. Additionally, we were helping with some legal kind of questions. There were a lot of human resource kind of questions early on about, thank you, about, what should we do when it comes to, time off, paid time off, a lot of those federal kind of decisions that were made, and how did those regulations kind of make it down to the business. So we had that as well as an option. We had some lawyers on staff that could answer those questions, and we could pay for those answers for them. And then lastly, we had hired some PR firms that could be on standby for businesses to help them kind of get messaging out after a COVID-19 exposure or incident, to make sure that people were understanding that we had worked with them and that they were ready to receive patrons or vendors again, and that they were safe to return to operations. And on the screen now, you can see just a little bit of the services that have been accessed since we started through just last month. If you'd seen my presentation before, back in January, that vaccine bar was much smaller as we just started, and now it's really ramping up. But you will see that still close to 50% is that business continuity, helping businesses remain open and understand how to navigate the current environment as things kind of change daily with different guideline updates, as well as the quarantine and isolation changes, post-vaccination now, as well as they update it from the 14 to 10 days. We do answer still just general COVID-19 questions into our office, as well as helping the health department with contact tracing efforts sometimes, especially in the schools. And then we handed out lots of masks. We did some infection control training with our election polling officers to make sure our elections locally were safe during the pandemic. We've helped with N95 fit testing for our local businesses, as well as our rescue squads and our other social service departments. We did some testing coordination with large businesses, think agriculture and manufacturing. And then obviously now we are headed in, ramping into that vaccine and really helping businesses get access to it.
Terrific. Oh, that's a whole suite of services for sure. How many jobs would you say have been impacted by the services offered by the business continuity team?
Yeah, and I think this is the biggest number and most exciting number. So I've got a slide for emphasis. And so it's nearly 20,896 and counting jobs that have been impacted by our services that you just saw me flash up, which is really great. I mean, I think about how many people work in the New River Valley. That's really just, heartwarming to know that we were able to help businesses keep those jobs afloat during the pandemic.
And why don't you go back that one slide? I think people will be interested to see the types of the business sectors that you've been serving too. Yeah,
so it's nice when a graph kind of flows with the percentages of the types of business we have locally. Retail trade, our businesses like our brick and mortar stores, and then other services include things like barber shops, nail salons, car oil changes. Then we've got manufacturing, that's pretty self-explanatory, accommodations and food services like our hotels and restaurants, public administration, that's our local government, and then healthcare and social assistance, that includes our hospitals and things like our community services offices and childcare facilities. And then educational services, those are our K through 12 schools. We've got real estate and leasing offices, construction, and then arts, entertainment, and recreation, like our local gyms, those types of partners. And agricultural and forestry are things like our manufacturers of agricultural and forest products and food as well.
So basically, you just listed off every industry in the region.
Yeah, it's pretty comprehensive from top to bottom. Every industry has been represented and touched by our program.
That's fantastic. And we'll share more information here in just a minute about how people can access the services of the business continuity team. But before we chat about that, how has the business continuity team role changed since we moved into the 1B vaccination group?
Yeah, it's definitely been a really unique opportunity in the New River Valley. Businesses are able, their HR director or business owner themselves is able to interface with me directly and sign up their employees through block scheduling. We've also worked with our local manufacturers that have on-site medical offices for their employees to redistribute vaccine, I should say, from Dr. Bissell directly to them to offer on-site clinics for their employees. So it's really helped get the vaccine out into that 1B industry community as quickly as possible, and allowed employees to access the vaccine that may have had hesitancy or have a language barrier that they weren't able to access the online resources that we had in English. So we were able to work with interpreters directly through their HR department so that they got what they needed and the information they needed in a digestible and understandable fashion.
Excellent. That's quite an impact. So where do people find information about the business continuity team, and how much does it cost to use the services?
So the first one, where do you find us? You can find us at the NRV road2wellness.com website. We have our own page, the business continuity team page. You'll find a vaccine interest form link there for businesses to pre-register with me on behalf of the entire business so that we can get you all in at the same time and help you stagger appointments so that you don't lose business continuity during this vaccination program. I also have there, you can find my phone number as well as my email address to get in touch with me personally. And then it's a free service, which is so exciting that our local governments had gotten together and really helped stand this program up with our funding partners and grants and things like that so that we could have this service available to our local business community at no cost to them.
Terrific. And we've had a lot of partnerships with the state and helping to fund this as well through the Go Virginia program and community development block grants, which has made a real difference. So thank you, Ashley. Next, I want to talk a little bit about mental health and look to James here for some insight. So what are some of the key issues the mental health system is observing right now?
Well, this year, like we all know, it's been a challenge across the board. Early on, we had to pivot to try to deliver services in a new way. We had individuals who obviously needed services to continue their recovery or their wellness, mental health wellness. And then we had individuals who were suffering because of the pandemic and the isolation and anxiety brought on by it. So I think it was probably within the first month of the pandemic that our staff, because of their passion and creativity, got together and figured out how we could deliver services to those individuals in need, either our current clients or new clients, people in the community who wanted to access services. So we were able to put in place measures to provide telehealth services. And that was a big lifesaver for a lot of people. They could continue their treatment. They could access services if they needed them through telehealth. And our business, unfortunately, really picked up because of the demand. People were struggling, and what we saw was an increase in referrals and requests from services, not only directly from individuals and families, but from our partners out there in the community, whether that be the court system or the Department of Social Services, or even the schools calling because of concerns around individuals that they had contact with. So we were very happy and I guess just amazed at the work that our staff did to put things in place to make sure services were available for people. We haven't really seen a decrease in services, even though things are getting better. And as we've talked about, we can almost see light at the end of the tunnel here. We still see a high demand and request for services, and we're able to meet those. Over the last month or two, because of some of the information that's already been shared and what we see as that light at the end of the tunnel, we've been opening our doors more and trying to adjust our programming. Even though we never shut our doors and we were able to provide services in our facilities, we did a lot through telehealth, but individuals need to come in for services sometimes or want to. I think part of it's been the isolation. We've also really been worried and thought through how we engage people who don't have access to social supports. And our staff, again, have been pretty creative to set up support groups and activities online for people to engage in. But we're excited to hopefully start opening our doors a little wider and have some more traffic in our buildings. Of course, we'll be taking the safety precautions, but it is hopeful. And I think that's what our business is about, is providing hope to people.
Very good overview of current state of things with mental health services. And can you talk more about a new initiative that your organization was spearheading, the Crisis De-Escalation Center, and its role in the mental health services?
I'll be glad to. As I said earlier tonight, we've been a proud partner of the task force, and working with the task force as well as our partners in law enforcement and local government, we were able to access some of the CARES funding, and that really allowed us to build out a new facility in Radford. It's our crisis center. And the goal right now is we can divert a lot of individuals from the emergency rooms at our local hospitals to that center to be pre-screened if they need to be evaluated for possible hospitalization, or to de-escalate them. And again, the whole goal is to keep them out of the local emergency rooms where there's the possibility of being exposed. And not only were those individuals seeking services probably going to be exposed, but we had our law enforcement that they also had that risk. So the goal of that crisis center initially is to reduce the risk of exposure. Once we start seeing the pandemic come to an end, we're going to expand the services offered out of that facility in Radford to allow individuals and family members to actually seek services there themselves. And we believe that will deter a lot of hospitalizations or folks having to be transported to other state facilities outside of our area for inpatient treatment. Our goal is to keep them in our community, treat them here. Obviously, we believe that that's the best approach to it. I also think that our law enforcement partners would be better able to serve our community if they remain in our community and don't have to transport people outside of our area. So we're hopeful that we're going to be able to open that side of the facility really soon. I know that as a system, as the Commonwealth is struggling with bed utilization at our state psychiatric facilities, it's really important that we try to intervene earlier with folks to prevent them from being hospitalized.
Absolutely. And you talk about transport, and we've heard those stories, sometimes driving clear across the state, consuming several hours of officers' time. So it sounds like a critical facility that you're all putting online here.
We hope so, and I see great benefit for the community once we open it back, fully up and it becomes fully operational. There's benefit not only for the individuals served there, but for the community.
Right. Well, if people are interested in seeking mental health services, what are some resources that you would recommend for folks?
Well, obviously, I would ask them if they want to choose us as a provider of those services, they can call our number, which is 540-961-8400, to access services. And when they request services, they'll be asked a few questions, and one of those questions would be, hey, do you want to come into the clinic, or would you want to have this service provided through telehealth? We're given that option, and quite frankly, a lot of people are taking us up on being able to provide services through telehealth right now.
Oh, fantastic. I know that added avenue has got to be very helpful for folks.
It is one of those things that I've advocated with some of the state legislators, that once the pandemic is over, that they still allow providers to be able to provide services through that avenue, because in our area, there's a lot of barriers to seeking services such as transportation.
No doubt. Well, thank you, James. In just a moment, we're going to start talking about vaccines and where the status of vaccine in the New River Valley. Before we do that, I want to ask about testing, because we still have cases in the community. So Dr. Bissell, can you explain testing sites, what that looks like these days in the region?
So yeah, we are definitely still testing in the region because so much of our effort is now focused on vaccination with our staff. We're no longer doing our large scale test sites. What we're doing is self-collected swabs, which are supervised. We're doing it 3 days a week at our Montgomery County location. In Giles County, they have been up and running and they're doing it daily. And we're about to bring Pulaski and Radford on board with doing self-collected swabbing. And we're working with Floyd as well. Anybody who is interested in getting a test or needs a test, they can call our regular hotline, which is separate from the vaccination hotline, the 540-267-8240. That does remain operative, and we still have people answering questions, talking about isolation and quarantine, talking to people about testing and getting them set up with testing. And just like always, testing through the health department is free, it's confidential, and we provide those services to anyone in the New River Valley. Very
good. And what does turnaround time look like these days for tests?
So we are getting our tests back for the most part within 24 hours. We have a great setup. As everyone knows, the lab that we're using is the Fralin Biomedical Research Institute, which is part of Virginia Tech. So we have a great setup that the courier runs tests pretty much every day, twice a day. And if we submit the test one day, we usually have it back by the next day. The weekends, we do have a little bit of a lag because they don't run 7 days a week. That being said, if we do have a need for testing because of an outbreak or something, we can arrange with them for weekend testing. That's the nice thing. We work very personally with them every day, and we can call on them if we absolutely need to. But with our numbers going down, it's very encouraging that the testing that we're doing right now is adequate.
Excellent. Thank you for that. So let's talk about vaccines. How do people pre-register for a vaccine?
So we've transitioned to a state website, and the link is on our Road to Wellness webpage, but it is vaccinate.virginia.gov. And there is a pre-registration there. People who are not internet savvy or don't have access can call a state hotline, which is 877-VAX, V-A-X, in VA. That's 877-829-4682. Any and everybody is encouraged to go ahead and pre-register right now, which is new. We had originally asked people to only register if they were in the phase, but this new pre-registration system collects a lot of information about where people are living. It collects date of birth, so we know age, and then it does collect information about medical conditions, because that's how we do go through our prioritization right now. And that's very important because we're in the 1B phase, which is we continue to get our 65 and older population, but we're also getting our 16 to 64 with coexisting medical conditions that put them at higher risk.
Well, lately I've been hearing folks say they received an email from the state, sometimes a text message from the state about their pre-registration. What does that mean?
So that is a legitimate email or text message. I know in today's world, everybody worries about spam. As we transitioned to the state system and they pulled the data in, what they found was that every district was doing things a little bit differently. And even within our own district, when we started our pre-registration system, we collected just very basic information. And then as we saw the phases develop and that we were going to need to collect information about medical conditions, we added that in. So the people that registered early on, they didn't put that information in. So as all of that information has been pulled into the state system, they're asking people to go in, and you can now go in and update your registration. So if you have any kind of changes to addresses or phone numbers, you can put in your preference for communication, whether it's email or phone. And then they do ask about occupation, because Ashley knows very well that there are different occupations in different phases. as we attack vaccination parallel, we need to get those who have the medical conditions at highest risk of disease. So it asks about that. But then we also need to keep our critical infrastructure up and running. So it asks about your occupation and what your risk is through your employment as well, so that we can tackle, and prioritize according to the CDC and VDH guidance.
So Ashley, you mentioned this earlier, but employers can contact you, correct?
Yes, employers can contact me directly to pre-register or go to the New River Valley's NRV roadtowellness.com website and pre-register their business there as well. Both are good avenues if a person wants to individually register and put that information in about their employment. I am still getting that information from the state daily. And then we also can work with the business itself. Maybe there's a reason that employees don't want to pre-register. We do have a lot of minorities that do have some hesitancy when it comes to pre-registering themselves, and we're much rather their employer be involved in the process and register on their behalf. And so there's kind of two avenues to make sure that no one in our critical infrastructure 1B group at this time is left behind in this vaccination effort.
Well, let me back up just a minute about vaccines. Where are we in general in the region? Dr. Bissell, why don't you answer that one for us?
So, our supply is not nearly as great as our demand. So we do have to continue to prioritize according to, the CDC and the VDH guidance. Our 1A was our healthcare workers and our nursing home. And as Jason alluded to, we've done a really good job getting those taken care of. And we've seen the results that our nursing home outbreaks are pretty much non-existent now. Our healthcare workers, we've reached out, we've worked with our hospital systems, we've contacted through direct outreach. This includes hospital workers, it includes private practices, it includes our physical therapy, occupational therapy, speech therapy, our home health care, our hospice, dentists, dental workers. So it's a very large group. And at this point, we aren't seeing many more of them coming through. So we feel like we've done a good job completing our 1A. So we transitioned to the 1B. We're working through our critical infrastructure in the 1B, which does include our manufacturing, and we're working very closely with them through Ashley. And then it includes our 65 and older. We did start with 75 and older, and now we have worked well through our 65 and older, and we've moved to our 16 to 64 with coexisting medical conditions. People who've been following it might realize or might remember that 16 to 64 with coexisting medical conditions were initially in the 1C, and then the governor moved them up to 1B, and the CDC moved them up to 1B. So when you look at 1B, the phases 1A and 1B, that's about half the population of the New River Valley, half the population of the state that's eligible in the 1B phase right now.
You mentioned the 75 plus and 65 plus. Obviously, you want everybody to pre-register with the state, but they can also call the vaccine scheduling center too. Is that correct?
They can call our local center, 540-838-8222. And talk to a live person. And that's really important for people who may not have internet access, who may not be internet savvy, or what we've had is a lot of people who live out of town who are friends or relatives calling for someone who lives in town and may not have the resources to do that. So this really is an effort that takes a village. We encourage friends, neighbors, relatives to please reach out. If we don't know about someone, we cannot vaccinate them. We also get calls about homebound individuals, and we work very closely with our volunteers, with our hospital partners, and we will go vaccinate homebound individuals at their homes. So we're doing our best to leave no stone unturned as we make sure we try to offer the vaccine to those who are at highest risk, and those who might not be so digitally savvy or have access to the digital world.
Well, you all have administered tens of thousands of doses now in the region. What are some of the common side effects that you all are observing from residents in the New River Valley?
So the vaccines we have, there are 3 of them that have been approved now, and we have administered all 3 in the New River Valley, the Moderna, the Pfizer, and the J&J. They all have very similar side effects, and overall they're very mild side effects in general. And this is pretty much consistent with vaccines in general. The most common side effects are going to be a sore arm from where you have the injection into that muscle. You may have some redness or swelling locally as well. Then you may also have some achiness of your muscles. You may have a headache. You may feel a little bit under the weather, kind of flu-like or something like that. That's actually a good sign, because that's a sign that your immune system is kind of ramping up its fighting effect against the virus that we're vaccinating. So those are very common side effects, very normal side effects. In most cases, they last only hours to maybe a day or two at the most. And they're very well tolerated for the most part.
Very good. Well, it seems like every day in the news, we're seeing another pharmacy that's participating with the vaccine program. And I've come to understand that there's a difference between the federal pharmacy partners and then the local pharmacy partners. Can you talk about how that distribution of vaccine works?
Yeah, so there are definitely two pots of vaccine. The federal vaccine comes straight from the federal government directly to those pharmacy partners. I don't know how much they're getting, when they're getting, or where they're getting it when they do get it. So federal vaccine is going to CVS. Currently in the New River Valley, we have two CVS stores, the Dublin store and the Blacksburg South Main store. The federal vaccine also goes to select Kroger stores. So we have a Kroger in University City Boulevard, I believe. And I forgot to mention the CVS in the Target store as well. We will also start seeing vaccine at Walgreens. And I don't know when, and then at some of our Walmart stores as well. So that will all be coming as the vaccine supply opens up. And again, that's not something that I have any control over, and that's not something that we schedule. So those are scheduled directly through CVS or Kroger. And then when we get the other ones, it would be scheduled directly through them. Everyone has asked them and they're to try to abide by the same prioritization, that they stay within the 1B group and vaccinate those who are 65 and older, and now those who are 16 to 64 with coexisting medical conditions. The local pharmacies, those are the ones that have been getting vaccine through my allocation, which is a statewide allocation. I think the pharmacies are out there. We have Martin's Pharmacy, we have Blacksburg Pharmacy, Christiansburg Pharmacy, Davidson's Pharmacy. We've also been working with Food City pharmacies, although I will say they're transitioning to the federal program as well, I believe. So I have to kind of see where that goes. But we early on established relationships with them to be able to get the vaccine out more broadly. When we're looking at our vaccine, we're trying to do it efficiently, and we're also trying to do it equitably. And so when you're trying to get large numbers of vaccine out there, you want to have sites where you can administer large numbers of vaccine. And that's what we've been doing. We've been targeting, our critical infrastructure, and then we've also targeted our elderly population as well. But we know that some of our elderly population is not going to always be able to travel very easily, and that they may have more of a trusting relationship with their pharmacist. So we've tried to point to our local pharmacies, and I actually want to add one, at the farmhouse in Floyd. So we've tried to point to our local pharmacies to really reach out and help their community and getting them access to the vaccine as well.
And so how do people sign up for a local pharmacy partner vaccine?
So our local pharmacy partners work with us through our pre-registration process, and that's really important to know, because we want to be consistent throughout the entire health district. So anyone who is pre-registered through our process, we can now pull down information about where they live, and we try to direct our Pulaski and our Radford folks to the right place. We try to direct our Floyd folks to the right place, and our Montgomery County folks. So we're trying our best to kind of match people with where they live and where they have better access to the vaccine. But we're also trying to continue with our distribution according to the prioritization. So we're encouraging our pharmacy partners, our wonderful partners for access. We're encouraging that everyone registers through our pre-registration site, and then we work to get them lists. And so we distribute the vaccine to them, and then we distribute a list to them for them to be able to get people vaccinated.
So when people receive that phone call to come and get vaccinated, to have their appointment, what should they expect when they arrive at their appointment? What do they need to have with them? And then just what does that look like for them?
So we do have a list. It's still, again, the supply and demand, we still have to have a list. It's all by appointment only. So even if we are doing a site of 1,500 or 2,000 people, or if our pharmacies are doing a large site of several hundred people, we still have to have appointments. So wherever you go, they'll have your name on the list, and we need to have you provide identification that you are who you say you are. And when you check in, there is paperwork that has to be done. There are encounter forms that have to be done. They'll check your ID. They'll get you in. You fill out the paperwork. You get your vaccine, and then you'll have to wait for your 15 minutes just to make sure there are no reactions to the vaccine. And you'll get a vaccination card when you get your first dose. When you come back for your second dose, if you bring that back in, we can kind of complete that card for you. But you still have to do the paperwork with each dose, because every dose has to be entered in the Virginia Immunization Information System, and there has to be that paperwork to make sure it gets entered.
You mentioned that the vaccine type is written on there. Do residents have a choice of which vaccine they receive? You mentioned there's 3 currently being distributed in the region. Do folks have a choice?
So right now, the first 2 that were approved were the Moderna and the Pfizer. Both of them are mRNA vaccines. Both of them have pretty similar information about efficacy. So we weren't giving people a choice because, quite frankly, it depended on the distribution and how much I got each week. And so we were offering doses based on what we received, because as soon as we got it, we were distributing it and we were administering it. With the Johnson & Johnson, there's been a lot of attention paid to the efficacy numbers and the single dose of the Johnson & Johnson. What I will say is, even though people see some information that suggests the Johnson & Johnson may be a little bit less efficacious, you have to understand that those trials were done differently. They were done in different geographic locations, different populations, some areas with the variant circulating, those kinds of things. So you can't compare all 3 of them head to head, because it really is comparing apples to oranges. But the one thing is that all 3 vaccines are extremely effective in preventing serious illness, hospitalization, and death. And that is a huge public health success for us. So all 3 of them do that. Because there are differences with 1 dose versus 2 doses and some of the efficacy numbers. When we offer the Johnson & Johnson, we do tell people that if they would prefer to wait for the Moderna or the Pfizer, they can stay on the wait list. They will not lose their space, and they can get the Moderna and Pfizer. Actually, though, we have a lot of people who want the one and done Johnson & Johnson right now. So we're also keeping a wait list of people who want the Johnson & Johnson. And that's through the vaccine call center, the 838-8222. We did get initial allocation of about 5,000 Johnson & Johnson doses. They have all been administered. And I've been told recently that I am not going to be expecting any more Johnson & Johnson till the end of the month.
Okay. Well, that's pretty remarkable. I think you might have had a week's notice, perhaps that much, about that vaccine volume, and then to have a system that the task force has put in place to be able to locate those people, contact them, and have them show up at appropriate times to administer 5,000 doses. That's impressive.
Yeah, the only constant is change. I found out late Sunday night, about midnight, that I was going to be getting 5,000 doses of Johnson & Johnson, but I did not know when I was going to get it. So obviously you can't schedule until you know when. On Monday, I got notification that it was shipping and that I should receive it by Wednesday. And we had people in our district, some of our pharmacy partners were administering it as early as Thursday. And I think most of the administration of Johnson & Johnson was Thursday, Friday, Saturday, and Monday. So, we had a pretty quick turnaround time on it. Our weekly allocations, everybody knows that sometimes we had to make some adjustments to our clinics because of weather. and we had weather-related delays of either vaccine or supplies or both, and you can't administer one without the other. So it's a weekly, daily, sometimes hourly adjustment that we have to make based on what we have. And that's, we ask people to be patient. We ask people, to understand the logistics. And, we're doing the best we can to get it out there as quickly as we can once we receive it.
And it sounds like you've had a terrific partner in all of this for the vaccine distribution at Blue Ridge Church. Do you want to speak about that site?
Yeah. I mean, we are extremely grateful to Blue Ridge Church. I mean, we started this vaccination effort in the middle of winter, and we've already seen some of the issues with weather. We did a lot of outside drive-through testing. Obviously, that was what you wanted. And my nurses were out in all kinds of elements, both the freezing cold, the pouring rain, the blowing wind, and the really hot summer months. You don't want someone who's trying to administer a vaccine to have their fingers numb because of the cold. So we really wanted to have a site where we could be indoors and we could do the best we could with getting a large number of people through and still practicing good precautions. And Blue Ridge offered their site to us. They were the most gracious hosts. They basically worked with us to do anything that we needed. They accommodated us. They helped us with our setup. So they would take pictures of the way we had it set up. And when we broke it down for the weekend for them to have their services, we'd come back on Monday morning and they had put everything back for us. And anyone who's been through there can see that it's quite the setup there. They provided us snacks. They provided us water. They were just incredibly gracious. And, I told them that we vaccinated over 35,000 people through there. So that's just an incredible thing. And it's not always been without glitches, and it's not always been without some frustration. And we appreciate their patience. We appreciate the neighboring business patience, but we really are outgrowing that area because we're going to be looking forward to when the vaccine supply opens up, and we'll be hosting even larger scale clinics. The largest one we did at Blue Ridge Church was 2,200 people. That was pretty amazing. But we are looking to doing, 25, 3,000 or more. So tomorrow will be our last day at the Blue Ridge Church. And again, we cannot thank them enough for their wonderful, wonderful service to their community.
Oh, well, thank you for their comments about Blue Ridge Church and everything they've provided. And it's also good to hear about outgrowing the church. So sounds like people need to stay tuned about future vaccination sites, and people can do that by following the website that we've referenced several times this evening. So really encourage you to go to nrvroadtowellness.com. You can follow along there about vaccine distribution. Please make sure you pre-register, and we'll be in touch as soon as vaccine supply is available. So we've reached the end of our 1-hour program. I want to thank the community for submitting thoughtful questions, which spurred some really good conversation among our panelists this evening. And I'd also like to thank each of our panelists for your participation and contributions. As we look to the future, the Public Health Task Force is creating the playbook for everyone in the NRV to navigate the next phase, and that's recovery. If you know someone interested in watching tonight's program, but they were unable to attend, the forum will be archived on YouTube. Links will also be posted to agency websites and social media. The forum will also be rebroadcast on local access cable stations, including Comcast and Shentel Channel 190 for Christiansburg and Montgomery County, along with Comcast Channel 2 in Blacksburg. A summary of tonight's forum will be available online at nrvroadtowellness.com. And before we wrap up this evening, I would like to extend two special thank yous. First, to those that are behind the scenes who have made the virtual forum possible, and they are the public information officers who serve local governments, agencies, and the higher education institutions in the region. And second, to all the volunteers supporting the regional response, offering your valuable time to the Vaccine Scheduling Center, the on-site vaccine clinics, and serving as vaccinators. If you're interested in volunteering, please visit nrvroadtowellness.com website for more information about signing up. Each hour that you volunteer is helping to move our community out of the pandemic. So thank you and be well.